Tooth extraction refers to the procedure of removing a tooth from its socket. Before we start, it's important that you notify your dentist of your medical condition, such as whether you have any artificial joints, diabetes, or a history of heart and valve conditions. You should also inform your dentist of any medications you are currently or have previously taken, such as Redux, Fen-Phen, blood thinners, or importantly, medications that contain bisphosphonates, like Fosamax. So here's how an extraction is done. First, a local anesthetic is applied to make the procedure more comfortable. In some cases, your dentist will elect to use nitrous oxide gas in addition to the anesthetic. Once the area is numb, the extraction begins. A dental instrument, called an elevator, is used to wiggle the tooth in its socket. After the tooth is loosened, it is removed using forceps, or in some more complicated cases, a surgical handpiece is also used to assist with the removal of the tooth. Like most other procedures, tooth extraction is not free of possible complications. You should be aware that there is a slight chance of infection, tenderness, prolonged bleeding, dry socket, and loosening of neighboring teeth or their fillings or crowns. Another rare possibility is a tooth being displaced into the sinus during an extraction of an upper tooth. Lastly, jaw fracture is also a very rare possibility. You need to be aware of the importance of replacing this missing tooth. Why? Once a tooth is removed, the space created by the missing tooth will allow the surrounding teeth to shift into that space. This shift could cause a misalignment in your mouth that can result in chewing or jaw joint problems. These shifted teeth are harder to clean, making them more susceptible to gum disease, decay, or even additional tooth loss. For these reasons, it's important to replace the tooth with a dental appliance such as a bridge, a removable partial denture, or an implant. In some instances, you may be considering the option of pulling a tooth rather than simply repairing it. While it may be less expensive in the short run, in the long run, it may cost you more. As you just heard, once a tooth is pulled, you still need to fill the space with a dental appliance to avoid future complications. If you add the cost of extraction, plus the replacement of the tooth, you may simply be better off repairing it. Please be sure to ask your dentist for proper home care and post-operative instruction care. Your third molars, commonly known as your wisdom teeth, are typically the last teeth to erupt in your mouth. If healthy and functional, your wisdom teeth can be useful. However, there are also reasons behind why you may need to consider removing your wisdom teeth. In some cases, your wisdom teeth are in fact healthy, but because of orthodontic treatment, they need to be removed anyway. In other cases, your wisdom teeth can become impacted or only partially erupt through the gum in a misalignment. When impacted or partially impacted, your wisdom teeth can cause swelling, pain, and even infection of the surrounding gum. They can also put pressure on the adjacent teeth, which can result in permanent damage to these otherwise healthy teeth and their surrounding bone. Sometimes, impacted or partially impacted wisdom teeth can also lead to the formation of cysts, and in worst-case scenarios, even tumors, which could potentially destroy an entire section of your jaw. Lastly, a fully erupted wisdom tooth needs to be removed, because they are very hard to clean and can cause severe tooth decay. So for these reasons, sometimes the smart move is to have your wisdom teeth removed. Before we start, it's important that you notify your dentist of your medical condition, such as whether you have any artificial joints, diabetes, or a history of heart and valve conditions. You should also inform your dentist of any medications you are currently or have previously taken, such as Redux, Fen-Phen, blood thinners, or importantly, medications that contain bisphosphonates, like Fosamax. Whether your dentist or a specialist is performing the extraction, the procedure is the same. First, a local anesthetic is given to make the procedure more comfortable. In some cases, your doctor may elect to administer nitrous oxide gas in addition to the anesthetic, or use a general anesthetic to put you under entirely. Once the area is numb, the extraction begins. A dental instrument, called an elevator, is used to wiggle the tooth in its socket. After the tooth is loosened, it is removed using forceps, or in some more complicated cases, A surgical handpiece is also used to assist with the removal of the tooth. Like most other procedures, tooth extraction is not free of possible complications. You should be aware that there is a slight chance of infection, tenderness, prolonged bleeding, dry socket, and loosening of neighboring teeth or their fillings or crowns. Another rare possibility is a tooth being displaced into the sinus during an extraction of an upper tooth. Lastly, jaw fracture is also a very rare possibility. When should you have your wisdom teeth removed? There is no single right answer for everyone. However, if your dentist has advised that your wisdom teeth look potentially problematic, it's generally best to remove them sooner rather than later. This advice is based on the fact that the younger you are, the faster you heal. The likelihood of lingering numbness, jaw fracture, or other complications also increases with age. Lastly, the longer you leave the troublesome wisdom tooth in your mouth, the longer it has to cause further problems in the future. So, listen to your dentist, and don't delay the removing of your wisdom teeth when advised. Please be sure to ask your dentist for proper home care and post-operative instruction care. If you have any additional questions, please consult your dentist.
Now that the extraction is completed, here are some advices to help you with the healing process. Do put pressure on the wound. First, to control any bleeding, put constant pressure on the wound by biting on the gauze. Also change the gauze every few minutes for about a couple of hours. A cold compress or ice packs can also help this process. Do stay on a soft diet. For the first few days after the extraction, you should stay on a soft diet. This decreases the chances that you will disturb the site of the surgery. After a few days, it is generally okay to resume your normal diet. Do take the pain medicine. Following the extraction, it is very common to experience some discomfort, normally at the site of the anesthetic or the extraction site itself. To alleviate the discomfort, you should follow your dentist's recommendation on taking an over-the-counter pain medication. When necessary, your dentist may decide to prescribe a stronger pain medicine to manage higher levels of pain. Do not disturb the site of the extraction. Make sure that you do not disturb the extraction site. This means don't chew, rinse, or brush directly on the site for at least 24 to 48 hours. Do not spit or suck through a straw. This is important because using a straw often causes suction that can remove the blood clot. Loss of the blood clot causes bleeding or a painful condition called dry socket. Do not smoke. It is important that you do not smoke for at least 24 hours following the extraction, as smoking promotes the likelihood of bleeding and further delays the healing. Smoking may also cause the dry socket. Sometimes you may experience discomfort when opening your mouth. This is due to muscle spasm or trismus, which usually heals on its own in a few days. A little bleeding, swelling, and discomfort is normal after a tooth extraction. However, if you have any unusual bleeding beyond 4 to 6 hours post-operation, it is important that you contact your dentist immediately or seek assistance at your local emergency room if you are unable to reach your dentist. If everything seems normal, you can start to rinse with warm salt water 24 hours post-operation and be sure to keep the area as clean as possible. Visit your dentist for a checkup in 1 week after the surgery so your dentist can remove any suture and examine the wound to make sure it is healing properly, unless you have complications, in which you need to visit your dentist sooner. If you have any additional questions, please consult your dentist.
While every effort is made to make a good and functional denture, it is sometimes hard to achieve a stable and retentive denture. This is mainly due to the jawbone constantly shrinking with age, smoking, or some systemic diseases such as diabetes or even chewing pressure on the existing denture. However, there are new advances in making dentures. One such advance is an implant-supported denture that increases the stability of the denture. This kind of dental appliance requires the placement of implants in your mouth before making the denture. Dental implants are used to replace one or more missing teeth in your mouth. Implants are made of titanium or similar materials that are well suited to the human body. They are artificial replacements for teeth roots that support a restoration or a dental appliance. Before we start, it's important that you notify your dentist of your medical condition, such as whether you have any artificial joints, diabetes, or a history of heart and valve conditions. You should also inform your dentist of any medications you are currently or have previously taken, such as Redux or Fen-Phen, blood thinners, or importantly, medications that contain bisphosphonates, like Fosamax. It normally takes a few phases and several months for your dentist to complete the treatment. In the first phase, your dentist will place the implants in your jawbone. It requires 3 to 6 months for the bone to fuse to the implants. In the second phase, your dentist will place an extension or a post to extend the implants above the gum line. This process can also be performed during the first phase, depending on the technique chosen by your dentist. After your gums are healed, it is time for an impression to be made and a final restoration or appliance to be fabricated by the dental laboratory. In most cases, on your final visit, the restoration or the dental appliance is placed and adjusted to ensure proper fit and function. While every effort is made to place a successful and functional implant, it is not uncommon for implants to fail. This is mainly due to lack of proper attachment between the implant and the jawbone during the bone fusing phase. Other problems such as breakage of the implants, breakage or loosening of its restoration or dental appliance, and infection of the surrounding gums are also rare possibilities. Finally, due to differences in the shapes of the jaws and the bone density, the back area of upper jaw may require an additional procedure such as a sinus lifting to increase the predictability and long-term success. If you have any additional questions, please consult your dentist.